Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes, and we'll continue on here with the EMS Quick Study Resources. And this is episode 25. This is the IV therapy section. It's part 6, but the good news is it's the end of the IV therapy section. So we are finished after this episode. Okay? So, of course, I always answer the question, why is this important? And, of course, for exam preparation, I always say this is great stuff because a lot of the content you see here on these Monday Minutes are seen on many, many EMS exams, whether it's national, state, local, classroom, okay, very common key content areas that you're expected to know as an EMS professional, okay, so it's important. But along those same lines, it's important because it helps you with your patient care. It helps you with your documentation. It helps with your interaction with other healthcare professionals, right? So I always kind of say the same thing, but I'm trying to really drill that kind of point home, why this stuff is important and why these key elements are important, because I'm hoping that it guides you to seek out more information, to solidify what you see here by opening up that textbook, looking for other resources online, right? And refreshing your memory, whether you are a brand new provider or you've been doing it for many, many years. All right? So let's get on with this IV therapy, guys. Today we're talking about complications. All right? This is going to be kind of a quick episode, I think. We talk about complications because a lot of us know many of these complications, right? What are the ones? Pain, right? Duh. We all know that if you're giving an IV, if not the actual needle stick, of course, that's going to hurt, but pain to the site, right? And pain when you're flowing fluid and things like that is a complication and something is going wrong. Look for that infiltration. Look for the tenderness, the swelling, right? Catheter shear, right? Don't draw back the catheter, the needle, okay? Once you insert the needle into the skin and once it's been advanced, all right? Always pull the needle out first. So don't kind of go back and forth with the needle over the catheter. There is a chance you could shear it, all right, and cause issues with your patient, and of course further complications we'll talk about later on. All right, how about artery cannulation? Now, I've never done this. I've heard this happen, okay. When you get that bright red blood, you've hit an artery, it's almost like a pulsatile sort of pressure, and the blood is going to push the plunger of your IV catheter up. It's going to be, pretty pressurized, where you're going to see that kind of pushing the plunger of the IV catheter and the IV, up when you're trying to insert it. Okay, so keep that in mind, right, when you see that, and and you might have some issues stopping that bleeding once you get in there. Okay, and I think you're also going to see as well, if you do that and you try to hang a bag or whatever, it's probably going to be backing up into that bag. The flow rate of the bag is not going to be strong enough to push through the artery pressure. Okay. Something else we're talking about is things like hematomas or infiltration. I just mentioned that before, right? Where you get an injury to that blood vessel, a puncture maybe, or even the cannula itself gets dislodged. You might see things like edema, the skin might be blanched to that area. Of course, again, talk about pain, right? That discomfort, the site itself might be cool to the touch, and you're going to probably get either slow flow or probably no flow of fluid at all through that. And you probably won't, and you're not going to see any flashback as well when you try to withdraw, okay, or draw back from that area. All right, so keep that in mind when we talk about complications. All right, the hematoma is probably pretty obvious. You probably pretty obviously see that, but infiltration isn't always as pronounced depending upon where you're starting the IV. All right, a lot of times you'll see that bubble or that sort of infiltration around the area, but sometimes you won't, depending upon where it is in the vein and where the fluid is leaking out into around the surrounding tissues. What about local infection? Well, we talk about things like bacteria, and this is a lot of times, again, this is not necessarily a big EMS concern, right? because we're not really with the patients that long to be seeing this sort of infection. But when we do see these types of patients, it's usually when we're taking them from interfacility transports. Maybe they have an IV established and they're sort of like a home care sort of patient, cancer patients and things like that, where they have IVs established that they don't change or they change every month, things like that. So it's a good idea to kind of be aware of this. So if you see this sort of issue going on, it can kind of lead you to believe that there might be something infection-wise happening. And this is when bacteria gets introduced to the IV site, and you'll get that swelling, the tenderness. And again, this is usually maybe several days after the initial IV access. Okay, so like I said, we're not going to see it, but we might see it if somebody else has started the IV and we're doing interfacility transports and things like that. Another complication is air embolism. Now, I've never seen this myself. I'm sure you've heard of this. You might not have seen it either, but this is good information to know because, like I said, this is great for exams and it's great for when you're assessing your patient that, this might be something you might see, right? So this is when air gets allowed into the vein from the IV tubing while we flush the line, right? The IV set might get dislodged, itself, allowing air into the vein, right? Some things you might see with this is, patient might be hypotensive. You're going to see cyanosis, tachycardia, maybe some increased venous pressure as well, and the patient will become altered, right? The responsiveness is going to become less, okay? So again, it's not something we see all the time. You might see it on a test, all right? But it's also something to keep in mind that if you see a patient who has an IV established, there might be a potential that this happened, and you start seeing these signs and symptoms for an otherwise patient that wasn't exhibiting this, something to think about, okay? And the last thing is something called pyogenic reaction. Again, not something we often see in EMS, but this is when you're using, techniques that aren't really an aseptic technique, or you're not really using techniques that are, sterile, your sterile procedures, and you kind of laxadated with that, right? You can kind of get a foreign protein or something that can cause that fever and come in contact with the IV solution or maybe the administration set itself, all right? And this usually, reason why I mention this is because you can see this usually within about 30 minutes of the initial IV access, okay? So many of us out there have long transport times. So maybe you start an IV in the house and you're transporting your patient and maybe it's 45 minutes an hour, and suddenly your patient starts having additional issues on top of what your suspicions are while you're taking to the hospital, and they start having things like fevers and chills and maybe a backache, nausea, vomiting. They might have a flushing of the face, especially to the face, and maybe even sudden pulse changes, okay? So you start seeing that 45 minutes or so, 30 minutes into your transport after you start an IV, start thinking that maybe this might be going on, okay? Something to think about. Like I said, not really often seen in EMS. I've never heard of anyone experiencing this, but at the same time, you know what? This is the type of thing where you might actually have people that experience this and don't realize that the reason why their patient all of a sudden had chills and started nausea, vomiting, and became very flushed, and their pulse started changing, they're thinking it's something else going on, where it might very well be, in fact, be a foreign protein that somehow made its way into that IV fluid or onto the administration set, right? Stuff to keep in mind, guys. Stuff you might see on an exam. Key elements. This is, I think this here is kind of a big part. If this is confusing you at all, go check this out. Open your textbook, look it up, Google it, and get some more information, even just for your own knowledge base on understanding what this whole pyogenic reaction is, okay? All right, guys, that is it for me. Next time, we're going to talk about poisoning and overdose. Going to start getting into some really cool stuff and stuff that you're really going to be, I think, be able to take home some really valuable content and information on these Monday Minutes, right? We're getting past all the introductory content here on the Monday Minutes, and we're going to start talking about stuff that we're really going to see out in the field and how we're treating it, how we're transporting it, and how to identify these medical and traumatic issues. Okay, so next time we're going to start talking about poisoning and overdose. I hope maybe you'll take the time, and I have a link in the notes here, guys, for the EMS Quick Study Guide. Go check that out, because that is really the meat and potatoes of what you'll see on exams, and a lot of what we base these Monday Minutes on. Okay, so go check that out, guys, and see what's all included with that. It's a digital download, so you get to have it on your computer forever, right? And I've used that guide many, many times in my EMS career when it comes to studying and preparing for exams. So go check that out. Of course, if you have any Monday Minutes of your own, I'd love to hear your suggestions, what you'd like to see here on the Monday Minutes in place of or in addition to these EMS Quick Study tips. Send them over to me. My email is contact@emsofficehours.com. So until next time, as always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.